Hi, everyone. Thanks for tuning in to the YMyHealth podcast. I am today's co host, Julie Woon, and I am joined by our guest, Dr. Kelsey Botti, a doctor of physical therapy who brings both professional experience and some deeply personal experience to her work. She earned her doctorate in physical therapy from Chatham University in 2014 after completing her bachelor's in rehabilitation science at the University of Pittsburgh. And her special interest is in helping patients with POTS, a condition that she knows firsthand after more than a decade of living with some unexplained symptoms. She was finally diagnosed herself in 2021. And so she drew on that kind of frustration for lack of treatment options into her program. And so today we're going to talk a little bit about her personal experience as well as the work that she's doing with physical therapy in POTS patients. So, welcome to the podcast.
Thank you for having me. I'm so excited and to give the opportunity to explain a little bit more about POTS and bring awareness to that and, my story and what I do.
Awesome. Yeah, POTS is something that I think is very personal to our podcast. We've done episodes on it in the past, but I think it's one of those things that's still fairly either misunderstood or just not really well known. And so, as much as we can talk about it, we love to do so here. Um, Maybe we can get started just talking a little bit about your own journey, learning
Mm,
about what POTS is and how, how you came to be diagnosed.
Yeah. So what happened hindsight. I say like once you're diagnosed, looking back or looking through like a POTS lens, so much makes sense. But when you're going through it, you kind of just feel like crazy, right? Like all these symptoms don't add up. But it was in 20 2012. I was a senior at the University of Pittsburgh I was accepted into PT school, but it was like January, February of my senior year, and I had a concussion. And at that time in Pittsburgh, it was concussion awareness was very big because our star hockey player, Sidney Crosby, had just had a concussion. So I would say they were on like cutting edge of concussion treatment. So I was in the UPMC program, and a lot of things at the time were labeled post concussive, which made sense to me. Brain fog, all of that overlap truly made sense. The problem is I finished my concussion protocol and I was transitioning into PT school in the fall, and things just weren't going away. Some stuff got better for sure, like the neck pain, the neck injury, all of that kind of resolved from like a muscular standpoint, but I was left with hand tremors like crazy, the brain fog. I just never felt right. But they said, it can last for however long, and this was just part of post-concussive. So I worked with different doctors, tried medication, and now looking back, knowing how sensitive POTS bodies are, no wonder the medication, I didn't respond well. So pretty much made it through PT school, but I will tell you it was not easy because I just felt like things weren't I just didn't feel myself, but I just, post concussive, you got to keep going. The hand tremors though were something that it was hard in practicals and going into patient care. I'm like, they're going to think like, did you have too much coffee? Are you taking medication? I mean, cuz here's my hands like really tremoring. And then I would say over the 10-year period, because I wasn't diagnosed till 2021, and we were having this conversation in office yesterday. I mean, so many ER trips. It's a joke, but it's true that I used to be the most expensive person on my health plan
Yeah.
because all the different providers, and I wouldn't even say I mean, yes, they were misdiagnosed, but from what I've learned is providers are looking at their area, right? So if I would see gastro cleared me. But if I would see, um, you know, cardiology, they would clear me. So no one kind of looked at the whole picture. And in each realm, I was quote unquote fine, but I was still falling apart. So it wasn't until after the birth of my second son that things in 2020, but that was like the height of COVID. Offices weren't really open, and it was a weird time. So I had him in July. I was crawling to his bedroom. I didn't know what was wrong. And I really let things go until the new year of 2021. But I could feel what I now know are PVCs. And I'm like, something needs looked at. And then that's how I got to cardiology. And luckily, being in the health field, I had known, like, I rolled a ton of stuff out. So my time of seeing cardiology and getting the tilt to diagnosis kind of came quick, but I suffered for over 10 years of symptoms. And
Yeah.
hindsight, probably even longer than that, I just didn't know things weren't normal. They were my normal, but now looking back, like when people stand, not everybody gets dizzy or sees stars, but I just thought that was normal for my whole life.
Right. Yeah, I think that's very common from the stories that we've heard of
Mhm.
very long diagnosis periods or,
Yes, yes,
periods to being diagnosed because it is a mix of symptoms and a lot of our healthcare providers, they are somewhat siloed
yes.
from working together.
Mhm.
So that absolutely tracks, I think, with what we've heard. And, you know, that's obviously such a big part of your life, and it has
Yes.
now come into your work. So, wanted to discuss a little bit about how your journey has influenced your decision to sort of specialize within this area and with physical therapy.
It honestly, when I was diagnosed, I was in a rough spot. I was working in home health at the time, and I would pull into a patient's house, lay my head on the steering wheel, give myself a pep talk, go in, treat, come out, cry, and drive to the next place. So at that time, I mean, I was barely surviving. So the thought of doing what I'm doing now was, not even in my mind. It was survival every day. But when I was diagnosed, they called and said, okay, you have POTS. And I'm like, okay, and I'm type A personality. I'm like, hey, now what? I have two little boys. Like, I need something. And she was like, have water, have salt, spend time in each position. And I said, great, but I need more. And they didn't have more. So I really felt out of control, and you're scouring the internet, and not that there aren't some, blanket or very, I don't know, just handouts about pots. I felt like it was missing, like a community. Yes, there's Facebook groups, but also like trying to find like-minded people. I feel like that space was lacking. So I found the Cleveland Clinic and went out there and started that process. But as I went through that, I'm like, there is no support. I mean, through PT, being a physical therapist, I was able to kind of adjust and make adjustments to like how I'm pretty sure I should feel. But, there was no like path that was already paved in terms of support or people to help you through or just ask questions or hey, like when my first October, the October slide comes, I was like, what has happened to my body? There was just I felt like the info wasn't there. So then I thought after I felt better, I'm like, this needs to change and there needs to be something. And then that grew into treating locally in my office. And then now we have the POTS Life app where it's a whole community even in different countries because everybody's looking for the same thing and unfortunately I think it's not out there.
Yeah. I want to talk a little bit about, uh, yeah, your physical therapy approach to POTS and
Mhm.
how that differs from maybe a treatment plan that you're giving to somebody who's not experiencing it.
Yeah, so I think the biggest thing and it was even a surprise to me, typical exercise is kinda like no pain, no gain, and that is the worst thing for POTS. So I think even going through PT school, the traditional model of hey you got to push through a little bit to make these gains, yes there's a time and a place, but I would say probably 99.9% of the time with POTS that is not the case because what we know with POTS is we have very poor blood flow, right? It's stuck in our legs. So the misconception is, and I think this is where cardiac rehab is coming, but it's still a little bit much. If you're young, right, and you quote unquote look fine and you should be able to exercise at this heart rate, we push to that. But then there's people are symptomatic, not even just in cardiac rehab, just in life in general. We push too hard, and then you might not feel bad while you're doing it, but you feel bad that like 48 to 72 hours after. And then by that point, you did more harm than good. So really my approach is less is more. And sometimes, not even sometimes, most times, people are taken back because I get people, yes, that are bedbound, but I also get people that were running ultra marathon runners 2 weeks ago and woke up in their life. So everybody is starting at that low and slow point at the same. And sometimes they're like, "Well, I can do more." I'm like, "Yeah, but are you feeling good?" And they're like, "Well, no." So, really going back and I say like building a solid framework instead of this framework that any movement's better than no movement, right? But if it's not like the solid, slow approach, you have a lot of gaps in your framework. So you might be able to withstand for a little bit, but if an illness comes or stress or whatever it is to put that adrenaline cup over, you can't withstand it. So really going way back and slower than any approach I would have ever used in the clinic if I didn't have POTS.
Right. And I think you made an interesting point there where, movement in many ways, often it's, yeah, a more is better approach. And
Mhm.
that's not necessarily the case for somebody who's experiencing POTS. So, how does the physical therapy piece complement the other like medical management that's happening?
Yeah, I always say it's like a recipe if you think about it. So if you look at POTS as a recipe, I would say from my perspective, exercise is like your main ingredient, the right type and the right guidance and slow and steady. The so that is your main ingredient. Hydration and electrolytes, obviously right up there, right? Because we need that salt to bind to the water to improve the blood volume to let the exercise, work. Then I would say meds for sure. I mean, not everybody needs them. I have the whole spectrum, some that have to take a ton, some that do it without. I mean, that's more of like a personal, every single pot's body is different. And then what I say is the other stuff is complementary. So if I'm somebody, I know it's like probably, I don't know, controversial maybe. I don't love compression. I felt worse with it, but I know that's like a go-to for physicians, and it makes sense. The abdominal compression studies have shown, it's very helpful, and I have some that do it. I just personally, it didn't work for me. Or the other things, elevating the head of the bed, all those extra things I would say are like additional ingredients, but really the medication management, because all of the water, the medication, they're kind of those band-aids that allow the exercise piece to work, at the best chance it has. But if we're not drinking enough water, it's like you got to have everything just right to be able to see those improvements, which is frustrating. And it was for me. And I'm not saying every day is perfect. I'm fully transparent. I think that's why they come in office or on the app. Like, I know there are really tough days, and I know you don't want to go down and get on the bike. And I still have those days, and I'm almost 5 years out. So I think being able to relate to that frustration piece too is huge.
Yeah. And I think some of the things that we've heard as well is, maybe these POTS patients, they'll get a physician and they're being told, just, yeah, keep moving, but like
Mhm.
take it easy.
Yeah.
There's not necessarily a true approach, I guess is what I would say,
Mhm.
to the exercise being recommended. And so I'm curious how the like physical therapy specific part plays
Yeah.
into this.
Right. So I think someone said to me not too long ago that the things that are out there, there are those protocols that are out there, but maybe they're outdated or not translating as well, because the problem is it's just like they print the paper and they're like, here you go. And I was the same way through Cleveland Clinic. I have great physicians there, but it was just a piece of paper. And one, the accountability, if you already feel terrible, how it's so easy to talk yourself out of, well, I feel terrible. I'm not gonna, that piece of paper is not holding you accountable. So, and I think like I did a program that I biked 7 days a week. Most don't do that, but I was desperate. That's just where I was, and I just did it. The other protocols that are out there, yes, they have like the 3 day a week model, but while also what I'm seeing is maybe those month 1 or 2 are fine, but then it really ramps up and then they feel worse and then they fall off the wagon. So what I've done is through what I've seen in clinic and then my own personal experience, it is built lower and slower. It is structured around biking because that we know from research is the holy grail of POTS treatment. So it's 3 days a week biking, but way slower intensities. You got to go way back to be able, one, to have people stick with it and feel okay. My goal is for people to exercise and feel nothing. So when they're here, if you were a fly on the wall in my office and people came in all day and I'm like, oh, how'd you feel? Fine. Like, I don't want to hear you felt horrible, because the minute you feel horrible, we've just made it worse. And then what I've also seen is, just from my own personal experience, those protocols that were out there, they don't really have strength to complement it. So what happened was is like yes, blood flow, right, is so important, and we're getting it through the aerobic reconditioning, but there was no strength training that complemented it. So what I've done now using the PT knowledge is add exercises that slowly progress every week that meet you for where your blood flow is. So, yes, day one, like the other protocols, are you doing a straight leg raise? Yes. But by the end, are you doing way more? It's a joke, but it's true, like real life exercise, that feel like you're actually exercising. Yes, by month 12, but you're not symptomatic at that, and you're confident and you're not feeling bad because your body's ready for it. But to your point, like doctors will say, well, go move. So we're like, well, I'm young. I could run. I mean, I tried HIIT workouts and I'm like, am I dying in my basement? Like I didn't know. and
Yeah.
and so it's really having a team that can guide you to know you're like making the right choices, because you get diagnosed and you're like, well, I'm going to go do what I used to, and then you're like, well, I can't, and then you just feel lost, and then that's where people give up.
Yeah. I think that's a perfect segue because even just exercise, not being diagnosed with POTS can
Yes.
feel sometimes like this is impossible. I don't
Mhm.
want to do it. And it can be very hard to stick with an exercise regimen, just period. And
Right.
so, are there moments or techniques that you have to help people stay, with these programs and really keep this work up?
Honestly, I think it's the community that we build, and the access to have open dialogue like that. So whether you're in office or on the app, there's a chat feature and it comes right to me. Like when I created this, I never wanted somebody to feel like, oh, they just sign up and I'm on my own. Like, no, because I've been there. There's plenty of tears, and I say that, or change in weather, or people have questions around women's cycles. Things always go haywire, or you get an illness. You have to have open dialogue. So one, I can tell you like, hey, I've seen this, or if I didn't experience it personally, I always call it like KB research, because if I haven't seen it, or if I didn't experience it personally, I've probably heard from it from somebody else, or I at least know who I can ask if they've ever had it. So I think creating that community and that open channel to me and the team to be like, hey, or just to have an outlet to complain, that it is very hard and there are tiers. And I always say, when you sign up, like, or start a program, regardless, the goal is to never be as low as you are. You're going to go up, but it's going to be bumpy, and that's okay. But I also think creating the community, so whether they're in my office, they get to meet others with POTS, because I didn't know anybody when I was diagnosed, or inside the app, there's a community page. And yes, they can learn from me and what my team posts, but also the relationships we've heard that people related outside of the app, and they check in on each other, and just to try to create a community to, okay, this is horrible, but then they can lean on each other or us or whoever to like pick you back up and keep going. Cause there are for sure those days where you're like, forget it. I can't do it anymore. I mean, I've been there, and it's usually not just once. Like it's frustrating to have to get on the bike to walk around like everybody else in the world.
Yeah, absolutely.
Mhm.
Are there other common mistakes that you see in approaching either physical therapy or just exercise with POTS that somebody listening might, try to avoid?
I think one of the biggest is they just go get on a treadmill. And yes, you can do it. I'm not saying a good example is a patient of mine. We grew up together, and she's a graduate of the program. And someone asked her, they're like, well, she's a teacher. She has young kids. Her husband runs a business. She coaches soccer, but she was struggling every day. She was struggling before she graduated. And they're like, well, how do you do it? Or what, how? And she was like, I just do it. So, just because you're doing it and you can do it doesn't mean it's the right thing. So many go get on a treadmill, even if you start slow. But if we go back to what POTS is, when anyone stands in the world, 2 water bottles worth of blood around that go to your feet. In a pot, in a normal body, it just pumps back up. In a POTS body, it stays there. So that's why we go to biking. It kind of takes the gravity component out as much as we can. So you're allowing yourself to exercise at a decreased adrenaline state already. So if you go straight to the treadmill, because especially if you're young, that's just what we think we should do, or traditional exercise, you're like, let me do that. Or, you go straight to upright. well, then no one's going to get on the treadmill and barely walk at a speed or barely use an incline. So we just go too hard too fast. So I think just really I think once people hear, like, where that blood is, I think it's eye-opening for people to be like, "Oh, that's why." Or maybe you don't feel bad while you're doing it, but if 2 to 3 days after you are struggling, you gotta, like, kinda look back and be like, "What did I do to now feel like this?"
Sure. And I think talking a little bit about some of the positives as well. Can you tell us, any success stories or highlights of the work that you've been doing and what you've seen in patients who have started to use this approach in treating their POTS or managing their POTS?
Yeah, it's crazy. I mean, I know it sounds, I mean, because I've been there, they said to me at Cleveland Clinic, "Kelsey, the person you were before POTS is gone." And I looked at my husband, I'm like, "Oh my gosh." Like I was crying, like I just had my second baby. I cried the whole way home from the Cleveland Clinic. And but then they said the person after POTS can be just as good. And I'll be honest, that you don't I didn't believe them. Because I was at such a bad spot. Like, how could this actually get better? But I I can just say that, I mean, we have many graduates. I am an example, and I always say it's not a sales pitch, it's just like hope. It's to give hope that you do see wins along the way, and I think what's realistic, and I tell patients all the time is month the program is a year, right? So if I say give yourself a year, even if you're not doing this actual program, like give yourself a year. And if it's the right type of treatment, month 2 to 3, you should feel like little wins. Maybe they're not, to somebody else, they're like, "Oh, that's it." But, maybe you don't notice them, but family around you, friends are like, "Wow, she did that easier." What, just something that you were really struggling with. It can be as easy as standing at the kitchen counter making something on the stove, that static standing, you get to see those wins. Month 6, 7, you really get to see you stack those wins. So no, you perfect? No, but you string together more good days and you have less highs and lows. You're trying to just, really even that out to live like more of a steady life. And by the end, listen, where I was at the end of year 1 to where I am year 5 is even better, but you really have life isn't perfect by the end of the year, but you have the sense of you back. And I say it almost year 5, I don't think I knew how sick I was for so long prior to my diagnosis. So, I mean, you see the wins, it's slow and steady, but once you get that blood flow, it's almost like nobody has to convince you. You just start to feel it and you're like, wow. Like people are like, I know if I don't feel good, I'm going to get on that bike because they physically can feel that change. It's not anything that anybody has to promise or, convince them. They feel it.
Yeah. If there's somebody out there who, they maybe don't have access
Mhm,
to a POTS trained physical therapist or physical therapy in general. I know there's
mhm.
many areas, especially right now with what's going on with healthcare, where access is
Yes.
really difficult. Are
Mhm.
there small steps that they can take at home that would be safe and reliable?
I think, like I said, any movement is better than no movement, which is a hard concept because you already feel terrible. So I 100% know that, well, Kelsey, I feel horrible. How do you expect me to move? And I'm not saying, crazy movements, but even some lying down, if it starts by just some quad sets or looking up some lying down exercises, supine exercises, just to start activating those muscles. We need POTS mean that you feel terrible, so you feel like you shouldn't move, but then you don't move, and then you feel worse. So it's like a mindset thing too that like, okay, I'm just gonna start small. Even I mean, I have people coming from all different ways, and I say, even if we start with 5 reps, that's okay. Like we just gotta start somewhere. So looking up lying down exercises or even if you have to set it to just get up if you're laying in bed most of the day, even if you get up and say, okay, I'm going to walk to and from the kitchen 5 times, that may take all day, but that's okay. You just have to start small and then give yourself goals, and I promise you will build that tolerance. It's not quick, but you just got to start somewhere, as hard as that is. I 100% know.
Absolutely. And looking at, the future of POTS care and physical therapy, because again, this I think is still very much evolving. It's not new, but in many ways it is
Mhm,
still new.
mhm.
Where do you see the role of physical therapy, maybe expanding or changing with dysautonomia or POTS care?
I hope drastically changing. I mean, I have been a PT for 10 years, pretty much. No, a little bit, almost 11. And we didn't learn about this in school. My neuro professor in school, she was brilliant. I mean, she's so smart. And when her daughter was diagnosed, she called me and was like, "Hey, I need some guidance." So I think, we're just I hope it translates into PT schools because I think it is a main component. I mean, I know from my own journey and now obviously being a PT, but I know from my own journey how important that is because if just like cardiac rehab, right? You have open heart surgery, that's who you go to and they're great at what they do. I think PT now can fill that void, but I think we have like you said, quite a ways to go. I think COVID brought a ton of research and that's still all evolving, which is awesome. And I hope that translates into future PT curriculums. And even if there's not just hearing about it, right? Not everything I learn in PT school will I see in clinic, but I think just being aware of it or I had a PT, a patient in office, but her dad is a PT, and he came, and he's so right. I mean, we usually are sometimes people that kind of we get to spend one-on-one time with patients. So even knowing about it, maybe you don't treat it, but knowing about it and be like, hey, that doesn't add up. Maybe you should go see cardiology. So just to be kind of a quarterback of, hey, I've heard of this. Maybe you should look into it. To just get patients diagnosed quicker so, we're not suffering quite as long.
For sure. And, you know, just the awareness for sure, I think is a big part of it.
Yes.
Absolutely. I guess my other question is for these other types of providers, um, what do you wish they understood about leveraging PT to help manage POTS?
That it is so beneficial because POTS patients need the guidance because it's just the way of the world. We all kind of push too hard, too fast. So having somebody to guide them on what's too much or no, just saying to somebody, hey, you shouldn't feel just because you can do it, you shouldn't feel this, 3 days later. So just having kind of a teammate to bounce symptoms off of or bounce ideas. And I think the role of PT is underestimated, but in the same breath, I've heard stories from patients who have tried PT and they were pushed too hard. And I say it's not it's they're great physical therapists. It doesn't mean they're not. It's just the knowledge, like there's such a gap that it's not their fault. They're treating, I mean, I say all the time, I probably would have treated the same way if I didn't have POTS. But until you feel what that's like, it's hard to translate that, the simplest thing or just walking on the treadmill can make somebody feel worse 2 days later. Sometimes I think it just wouldn't have added up in my mind if I didn't have POTS myself.
Yeah, absolutely. And I think this has really covered a lot of my questions, but I do want to spend just
Yeah.
a minute to give you a chance also to talk about your practice specifically. Where can people find you? Um, you've mentioned the app a few times. Would love to hear a little bit more about that as
Yeah.
well.
So my clinic is located outside of Pittsburgh, PA, and we only treat POTS here. We just had a POTS awareness night this past week, and people, came from all over, and they're like, "So it's only POTS?" And I said, "Yeah, you'd really be surprised how many people are diagnosed just in this area, right?" And then what happened is I realized about the app will be 2 years old in March, but so at that time I was like, I can only be in so many places at one time, but you see the need and beyond Pennsylvania. I saw that need. So what we did is the program that I developed. So my program is biking, yes, but also strength training. And it's exactly what I do in office. And I saw the community support of that the patients got to see each other and we have a graduate here or we have somebody starting at month 1. It kind of gave them that hope that hey, hang in there, or somebody at month 6 could be like, listen, I know it gets rough, or to kind of relate that way. So I wanted that to translate beyond these walls, and I created the POTS Life program, and in that is exactly what we do, but it is like it's an app and it's right to you with nutrition support. Brittany, our nutritionist, is in there, and helpful documents and videos recorded by me, and just meditation ideas. So it is with a community support. So everybody that's in there, I mean, we have people in different countries, but they can all relate. And they've created those, like I said, those connections outside of the app, which is cool. And so you have all different walks of life, and everybody's coming with a different story, and they share that in there. But then also the chat feature, like I said, that comes right to me because I want it just like in my clinic. I wanted to be involved in the app 100%. So, because POTS is weird and you're going to need to repeat weeks, or you're going to need to adjust, or you just have questions, or sometimes you just need to vent that it's rough, you know? So, I am involved just as much in there as I am in my office. So people can really feel like we're walking with them instead of just doing it alone, because I did it alone and it is not easy. And this was hopefully a way to be like, hey, hang in there, to give hope that it can get better. I mean, if you met me 5 years ago, if my husband was sitting here, I mean, I think it was the lowest of lows when he saw me crawling to my bathroom. I mean, I'm 30 and I'm crawling to my bathroom at night because if I stood up, it was over. If I stood up, my heart rate would go crazy. I wouldn't be able to go back to sleep. So here I am at 30, like crawling back and forth from my bathroom, which, and I don't do that anymore. We're now helping others. And I just want people to know it gets better.
Yeah, and I think it's so nice to have those areas of community and support because, like we said, the awareness level is fairly low and there are pockets here and there, but to have, yeah, just that joint experience, I think in any kind
Mhm.
of walk of life is so lovely.
Right.
Um, if people want to learn more, where should they go?
Yes. So if you are local to Pittsburgh, PA, then my office is called KB Physical Therapy and Wellness. So that website would be kbptwellness.com. If you are not local, we have the POTS Life app. And like I said, that's for anybody anywhere. And what is nice, just like you said, there's these pockets, right? But the problem is, like, are you located near them, or does anybody know? So this kind of takes those, it takes away boundaries. It doesn't matter, those type of restrictions. It's all done at home. So that is the potslife.com. And our social media is on those websites, and, Facebook, all the things, Instagram. We also have our own podcast called Let's Talk About the POTS Life. And that is where, one, I share my story, but also graduate. So if you're kind of, you just, I, people have said that it's relatable. It's just relatable, and be like, man, that is me. But then also hopeful that, like, look, they got better. So I just think it's a cool community, and we're hoping to just grow and just give, honestly, like I've said so many times, just give hope that it can get better.
Excellent. Well, thank you so much for joining us today. This has been such a fun conversation, and I think a really exciting new element of POTS care that maybe people have not thought about, heard about
hmm
before. So it's been great getting to hear more about your experience and also about PT approaches to helping with POTS.
Yeah, thank you so much for having me. And I think it's such a great platform that you're sharing. I was listening the other day to the MCAST episode, and I'm just like, even me, and I do know a lot from experience, but I'm like, oh, I love that. So I love what you're doing. And I'm just so grateful that you had me on today.
Thank you. And for our listeners, if you've liked this episode or any of our episodes, please, we would really appreciate it if you like and subscribe, or leave us a review in the app of whatever your preferred streaming platform is. You can also check us out on YouTube if you haven't done so, where you can watch episodes as well. So thanks for tuning in, and we will see you next episode.